Last week, Medicaid expansion was assured by the voters in Idaho, Utah, and Nebraska. So now 36 states, plus the District of Columbia, will have adopted the Affordable Care Act's Medicaid expansion. In an additional 3 states, Kansas, Maine, and Wisconsin, thanks to the election of gubernatorial candidates who ran on an expansion platform, will also likely be expanding Medicaid, or at least not objecting to its expansion once they're in office. Hi, I'm Amy Grant of the ABL organization, and we've been watching this midterm election closely due to its likely impact on the healthcare industry. Because ever since President Trump's election 2 years ago, the longevity of the Affordable Care Act has been in question. Now it's much less so, with 63% of the voters' exit polls saying healthcare was an important issue for them in the midterms. So, thanks to the strong blue voter turnout across the country, resulting in the Dems taking back the House of Representatives, it's highly likely that the Affordable Care Act will be unchallenged in any meaningful way, at least for the next 2 years. Of course, providing Medicaid for more, if not Medicare for all, won't come cheaply. According to the Centers for Medicare and Medicaid Services, the nation's total Medicare spend reached nearly $3.5 trillion last year, and they estimate it will reach about $5.7 trillion by 2026, in just 8 years, if current trends continue. Since 1999, ABL has hosted Innovations in Healthcare to acknowledge the healthcare service, medtech, and health IT digital health companies that are trying to help us bend trend with their innovative approaches and technologies to deliver quality care much more cost-effectively. This year, 2 different groups of finalists will present their company's products and services in ABL's 19th and 20th Abby Award events. Each of the finalists will be vying for this guy as they present in Long Beach on December the 5th and in San Francisco on December the 12th. The finalists will be presenting are definitely using a blend of technology and human intervention to reduce the cost of quality care. For example, in San Francisco, the finalist presenters will be the CEOs of these companies: Atlas LiveTech, which works with hospitals across the country to train their staff in safe patient handling and mobility. Nothing's worse than dropping a patient during a transfer, except the costly workers' comp and liability claims that can follow. Atlas delivers a 95% reduction in lost work days, an 88% drop in claims and litigation, 89% lower average cost per injury, and a 65% reduction in injury rates, which in turn results in a decrease in insurance premiums. Another finalist, Care3, provides a team collaboration platform for healthcare delivered in the home and community. Their web-based Care3 Action Planner enables providers to build a single action plan for all care so that itemized task lists of care activities to be completed in the home by clinicians, aides, and family caregivers can be tracked, and everyone can stay connected via a mobile app, thus preventing costly emergency room visits and hospitalizations. Another finalist, Helpful, operates a community network where participants of all ages get and give practical help, share skills and talents, and enjoy common interests. Running on time tokens so members can pay for help with either money or time, Helpful's tech platform connects members based on compatibility so older members can get meaningful socialization and greater independence, and younger members can give back with a sense of purpose. Modio Health's credentialing and provider management platform helps providers slash credentialing times and reduce administrative effort by simplifying and more efficiently managing each provider's credentialing processes. Their OneView platform uses a type of blockchain that connects all entities associated with the provider with the same real-time data collection, which is automated, updated, and easily accessed and securely protected. And NeoFX Raphael Smart Glove for Home is a wearable, active finger and hand rehabilitation solution, particularly for stroke patients, that connects via Bluetooth to a TV or a tablet to display movements on screen, creating a gamified experience that takes traditional inpatient rehab that would be provided in a hospital into the home. Connected to the cloud, physicians can remotely monitor and analyze a patient's progress as patients stay engaged and motivated and track their own progress, as well as the physician tracking theirs. In my humble opinion, it's only by applying innovations like these and those of our 60 previous Abby Award winners that the nation will be able to afford Medicaid for more and Medicare for the 81.5 million beneficiaries who are expected to be on the rolls in 2030, more than double the 39.7 million in 2000. We'll be looking forward to seeing you at the Abbeys.